Hello everyone. In this video, I would like to discuss a very important topic, that is abortion. Medico-legal aspects of abortion, the different types of abortion, criminal abortion, its penalizations. So what do you mean by abortion or miscarriage? By definition means premature expulsion of the fetus. That means before the pregnancy is completed, there is expulsion of the fetus. Okay. Fine. So that is actually the definition for abortion. It may be natural, which may be spontaneous or accidental, or artificial, that is therapeutic abortion or criminal abortion. What do you mean by natural abortion? Because of some problem with the fetus, for example, fetal malformations like anencephaly, or any maternal conditions like antiphospholipid antibody syndrome, or any other critical illness of the mother, for example, severe preeclampsia. The abortion may occur in the first week of pregnancy, or second week of pregnancy, or third week of pregnancy. That is a natural abortion. So causes may be like any low-lying placenta, placenta previa, placenta accreta, severe or uncontrolled hypertension, uncontrolled diabetes, sudden shock, syphilis. Okay, all this. What do you mean by therapeutic abortion? In order to save the life of the mother, we are doing abortion. Fine. The very important question which comes here is the Declaration of Oslo, which actually adopted a resolution on the therapeutic abortion. What do you mean by criminal abortion? That means voluntarily, unlawfully, okay, without any therapeutic indication for the operation, we are inducing some destruction and expulsion of the fetus from the mother's womb before the third month or the first month or the second month. That is actually called a criminal abortion. It is also an unsafe abortion. So we have an important IPC called IPC section 312, which whoever voluntarily causes criminal abortion is liable for imprisonment up to 3 years. Whether it is the mother, whether it is mother's relatives, whoever, it is punishable. Suppose because of this abortion, if the pregnant woman dies, it is dealt under section 314, which leads to rigorous imprisonment, that is up to 10 years of imprisonment. And what a section 315 deals, that is preventing the child from being born. Again, it is punishable with imprisonment up to 10 years. And section 316 means like a culpable homicide of the baby. So coming into the MTP Act. MTP Act, which is an extremely important point. But remember, we have the recent MTP Act, which is not 1971, but we have 2021. Okay, 2020, 2022. That is the time when the Medical Termination of Pregnancy Act has been amended. Okay, has been amended. I will be dealing that amendment here. Okay. Fine. So, before going into that, let us see what are the indications of MTP. It may be either a therapeutic indications, that is endangers the life of women, eugenic indications, for example, if there is severe infection like German measles, smallpox, viral hepatitis, or if there is any humanitarian in case of rape, or social or environment. Coming to what are the, I would like to add a new page here, and I would like to say what are the important amendments that has been made under MTP Act 2022. Remember, only female's consent is required. Only female's consent is required. That means husband's consent is not required. Suppose if the girl is less than 18 years, guardian's consent is needed. Guardian's consent is needed. What are the qualifications for doing, or who can do MTP? Number one, RMP, registered medical practitioner, who has assisted in at least 25 MTPs. Number two, a registered medical practitioner who has done training in at least 6 months in OBGY, that is in obstetrics and gynecology. And number 3, any diploma or MD in OBGY. Okay. Coming to the Amendment Act. As per 2022 amendment, this MTP can be done up to 24 weeks. Only in some cases, up to 24 weeks. But if the pregnancy is because of contraceptive failure, MTP can be done only till 20 weeks. If there is any fetal anomalies, again MTP can be done till 24 weeks. Fine? Yes. I will say what are the conditions where MTP can be given under 24 weeks. Earlier, as per 1971, in all conditions, MTP can be done only in 20 weeks, up to 20 weeks. But as per, 20 weeks in case of 1971 Act. But we are following 2022 Act, in which contraceptive failure, it is 20 weeks. But in MTP or fetal anomalies and some other condition, 24 weeks. Remember, till 20 weeks, one doctor's opinion is needed for MTP. Whereas 20 to 24 weeks, 2 doctor opinion is needed. And beyond 24 weeks, a panel of doctors or a medical board opinion is needed. So 20 weeks, 1 doctor opinion. Earlier, up to 12 weeks, we have 1 doctor opinion. And 12 to 20 weeks, we have 2 doctor opinion. Now, 20 weeks, we have 1 doctor. 20 to 24 weeks, 2 doctor. More than 24 weeks, panel of doctors. And next, I would like to see what are the conditions where the MTP can be done up to 24 weeks. Number 1, okay, MTP can be done up to 24 weeks in case of a minor female. Who is a minor? Less than 18 years. Number 2, if she is a mentally unstable female. Number 3, if the pregnancy is because of a rape or an incest. Okay, or then coming to congenital anomalies. In that, we have to do, I told you, a medical board beyond 24 weeks. The medical board should consist of, who are the members of medical board? Gynecologist, a pediatrician, okay, a radiologist, and a person assigned by the state government. So these are the important points you have to remember. Okay. Remember, confidentiality has to be maintained for MTP. As far as MTP is concerned, confidentiality has to be maintained. What are the methods for procuring the criminal abortion? Number 1 is abortifacient drugs, which can be classified as drugs which directly acts on the uterus, called ecbolics. That means which increases the uterine contractions. For example, we have drug like quinine, lead. Okay, all this will or cotton root bark, all this will directly causes vigorous contraction of the uterus. Uterus will undergo spasm. Okay, that is called uterine tachyphylaxis. Okay, and that will further leads to expulsion of the fetus. Or emmenagogues. What do you mean by emmenagogues? Increasing the menstrual blood flow. The best example is sanguinary and estrogens. And irritants of the genital urinary tract like oil of turpentine and cantharides, as well as potassium permanganate tablets. Or we can use irritants of the gastrointestinal tract, which will cause irritation of the colon, which will produce hyperemia and contraction of the uterus, like the podophyllum, castor oil, croton oil. And drugs which has an poisonous effects on the body, like lead, copper, okay, then papaya, okay, unripe papaya, it's even in our village areas you will say, okay, papaya is an abortifacient, okay, or general violence because of the hemorrhage of the uterus, or intentional. For example, as you can see in movies, okay, that is the villain kicking the abdomen or the pelvis of the pregnant women, okay. And next, because of violent exercise like horse riding and cycling. And what do you mean by cupping? That is, a mug is turned mouth downwards over the light wick and is placed on the hypogastrium, and the mug is pulled, which will lead to separation of the placenta. Okay, and what are the other ways? We use something called syringing. Very, very important, syringing. Okay, these are the common instruments we will use. Okay, gum elastic catheter, Higginson syringe. Okay, then abortion stick. This is abortion stick. Abortion stick is a spotter. Okay, abortion stick is a spotter question. Then syringing. Okay, using Higginson syringe. This is again a spotter question. For you. Higginson syringe is used for performing criminal abortion. Okay, criminal abortion. Then by using rupture of the membranes, okay, like using uterine sound or catheter, we will rupture the membrane and we will expel the fetus, or we will aspirate using a syringe the fetus if it is like in the first week or the first trimester abortion, or we will do something called dilatation of the cervix. Whenever there is a dilatation of cervix, there will be what is the expulsion of the fetus. Okay, we will use pessaries to dilate the cervix. And remember, slippery M bark, okay, that is actually obtained from a tree grown in Central and North America. That is again an abortifacient. And abortion stick, which is a thin wood or a bamboo stick, which is wrapped, with a piece of cloth, and that has a drugs. Very, very important. These plants have abortifacient. Which of the following plants have abortifacient action? It is actually the marking nut, calotropis. Okay, marking nut and the calotropis. Fine. Then by using electricity, curettage, all this. These are the various causes of abortion. And next most important thing is, what are the evidence of abortion? What are the evidence of abortion? We can see the uterine sepsis. Uterus will be undergoing sepsis. Then the myometrium tubes and adjacent pelvic organs will be inflamed. There will be collection of blood in the vagina and uterine cavity. These are the external evidences that a woman has undergone abortion. Then okay, and here comes the question, what are the doctor's duty in a case of criminal abortion? Remember, the doctor should keep all information obtained by him as a professional secret. He must ask the patient to make a statement about the induction of the criminal abortion, and he must consult a professional colleague. He must treat her to the best of his ability. If the woman's condition is serious, he must arrange to record the dying declaration, and if she dies, he should not issue the death certificate, but he should inform the police. Okay, it's again a medico-legal importance. It's a medico-legal case, MLC. Fine? Okay. Then the difference between natural and criminal abortion. Remember, natural abortion is because of predisposing disease. Here, it may be an unmarried woman or widow. Okay, infection is frequent. Violence marks will be present in the abdomen. Contusion, lacerations and perforations of the uterus and vagina is common. Erosions and inflammation of the vagina and cervix is common. Foreign bodies may be present. And remember, wounds are absent. Okay, wounds are absent in case of natural abortion, where it is present. Okay. So what are the complications of criminal abortions? The complications of criminal abortions are, number one, okay, using the single picture you can remember the complications. Number one is oophorytis, that is inflammation of the ovary, okay, and the tubes. Next is called salpingitis, that is inflammation of the fallopian tube. Peritoneal hemorrhage, peritonitis, that may be the cause of death. Salpingitis, okay. Then perforation and septic metritis. What do you mean by metritis? Inflammation of the endometrium. Thrombophlebitis, aberrations, perforation of vagina, perforation of the vault, cervical necrosis, air embolism, amniotic fluid embolism. Amniotic fluid embolism is one of the deadly complications. Okay, it is a fatal complication. The woman will immediately die. Okay, on the table if not intervened. Then bleeding and infection. So these are the various complications. It is actually a must-known table. Okay, it is a must-known picture for you, the complications of abortion. Fine. Okay, so with this we have finished the important topic. Remember, the amendment in textbooks, it may be given the older versions of MTP Act, but remember the newer versions, that is up to what weeks, who can done, what are the qualifications of RMP, one doctor opinion needed up to how many weeks, 20 weeks, 20 to 24 weeks, 2 doctors, and panel of doctors in case of congenital anomalies, everything, which includes the gynecologist, pediatrician, radiologist, and a person who is appointed by the state government. And remember, okay, fine, this is MTP Amendment Act 2022. MTP Act 2022. So with this, we have finished this video session on abortion, criminal abortion, and its medico-legal importance and duties of a doctor in case of a criminal abortion. Thank you.